And welcome to Aging Matters, a program brought to you by the Berks County Area Agency on Aging. My name is Ann Barlet, and I'm the Manager of Community Outreach and Education for the agency. Our program this evening is on dealing with grief and loss during the holidays. I know it's a subject that we don't think about as much when we're looking at the beginning here of December and thinking we're getting ready for Christmas and other celebrations. And we're busy, hustle bustle, trying to perhaps buy Christmas gifts, maybe visiting with family and friends, baking cookies, going here, going there, and the season is just busy, crazy. And I thought at the same time that there were others that's not the case. It might be a situation where they are in the process of, in the middle of grieving for a loss of a loved one that may have happened recently, or currently happening, or in fact, maybe it's even an anniversary, and it's at this time of year that memories and issues are coming back to play. And I thought that the topic was most important to share some thoughts and ideas of how we deal with grief and loss during the holidays this evening. I have two guests with me, and welcome to both of you. To my left here is Amanda Huber. She is an RN, BSN, and case manager for Life Choice Hospice. And next to Amanda is Joyce Yoder, who is a licensed social worker with Life Choice Hospice. So welcome both of you. I appreciate your time here on the show. You know, kind of why did we go with Life Choice Hospice? And I think that's the best place to start. It is an agency that works with folks who are on hospice or who are entering the last maybe stages of their life and have seen and have experienced, these two folks have great experience with working with folks, not only the person who is in that process, but family and friends that are also part of it. So I really think that we're going to have a good show, and we've got a lot of good things to discuss. But I want to start first, and I think Amanda, you're going to share, just tell us hospice, what is it? I know there's misconceptions, myths, or misunderstandings. When does hospice come into play? What is it for? And then a little bit about the programs and services in general that are provided through a hospice agency such as Life Choice Hospice.
The biggest misconception with hospice is that people believe that once they come on services that, you know, they're going to die within those first few days of coming on service, and that's really not the case. Hospice is just the next step in what's the best benefit for a person's care. So you have somebody who, you know, they have cancer, they're going through radiation and chemo, and either the treatment is just not working for them, and, you know, the doctors have exhausted all means of care and treatment, or the patient and family have decided they no longer want to go through all the treatment. Mm-hmm. So then the next step is, what do we do? Well, you want somebody to still oversee their care, but now we're in another stage of their care. So we go from treatment to trying to cure, or in this case, cancer to be in remission. And now we're going to go into the next step where we're now going to keep them comfortable, give them whatever quality of life they have left. And in that time, you know, they're comfortable, and hospice is there to manage the symptoms that whatever comes about, you know, you keep them comfortable. So we know in the end that we may not have much quantity of time left, but we can guarantee that, you know, they will have quality of whatever time that is left.
And even in the time that's left, when we're talking about when one considers or starts with a hospice group and services, that and time can really be varied, can it not be? You know, as you alluded to, when they start. So, I mean, I'm sure you've seen, can you give me an idea of what time frames also has been part of somebody who's on hospice?
Sure. And I use cancer because that's how people can really relate to where, you know, when people come on hospice. But I've had cancer patients, pancreatic cancer, which most people know once they are no longer being treated, it's a short time before someone passes away. But I've had a pancreatic cancer patient that he came on hospice. We thought maybe 2 to 3 months maximum that, and then he would probably pass. Instead, he ended up being on hospice service for almost a year because he was taken off chemo, he was taken off radiation, we got him really comfortable, and he actually was okay for a certain amount of time. And then once the cancers really started to kick in, then we managed all those symptoms from there. So I've had patients that we've had them on service for 2 to 3 months. We've had patients on for a week. We've had some that have passed away within hours after coming on service. It really depends on, first, when we get the referral for hospice and how early, because again, there's that misconception that they have to be dying, like actually in this terminal state that they've got hours to live. And that's just not what we do at this point. So the earlier the referral, the better care they get, because we have more time to be able to get them comfortable.
And also at the same time, it's really any end stage situation.
Yes.
So it can be, you probably have seen, can you give us some other ideas of folks who have had different conditions that would be part of that?
Absolutely. So the shocking part for most people is that cancer is not our #1 diagnosis. 36% of hospice patients are cancer. The other 63% are actually, in order, it would be dementia, heart, and lung disease, and then some other more natural age-related diseases after that. A lot of people seem to think that I take care of cancer and HIV. That is not the case. It's normally heart, it's usually some sort of mental illness, which dementia is their biggest, Alzheimer's disease, and then it would be heart and lung. And sometimes it depends on what's going on. I mean, the lung disease is highly related to emphysema, not always from smokers either. So again, it's a lot of it is very much natural age-related diseases.
And then the one natural step would be, you mentioned about referral. So how do referrals get made to you? Where do they come from? Who can make a referral?
Actually, anybody can make a referral. We've had plenty of people have called our office and have, family members have said, I want mom or dad to come on hospice, what do I do? The next step would then be, if they're at home, you get a family doctor, the primary doctor, whoever is the doctor that is overseeing them. It could be the oncologist or cardiologist. Either way, we have to have a doctor be able to actually write out the order for us to come and eval. And then from that point on, we go to make sure they're appropriate for hospice. Medicare guidelines, we have to look at and go, are they terminal in end stage? And sometimes there's people who have this decline in their disease, but they're not end stage yet. Their condition has worsened, but according to what we have to look at in terms of criteria, they're not terminal yet. So, those are kind of where we have to say, yep, they're appropriate for hospice, which is then the next step is making sure family wants to have hospice or that the patient wants to have hospice. And then we have that talk. If the patient is in a nursing home or assisted living or anywhere that's community-based, the office, the nursing station, or the director of nursing, they will then contact the doctor and say, this person is declining, we need to make a referral to hospice, and then the same thing, we get the order to eval, assess if they're appropriate, and then go from there, let the facility know they're appropriate and the next steps to take.
So it sounds like really the referral sources could also, besides family for in-home, can hospice services be provided in a hospital or a long-term care setting like a nursing home or somebody who might be in personal care? You will go to those facilities as well as somebody's own private home.
Wherever someone's home is.
Okay,
Yes,
wherever
home
their
is. Home is, yes.
Okay.
A hospital setting is a little trickier. majority of our patients are on Medicare. So then Medicare says if you are in a hospital, you are technically being treated, you are not considered comfort care. So then what we have to do is if a hospital says we have someone who's terminal, we're afraid to take them in an ambulance back to their regular place of home, but we really need comfort care. So we have to go in and then assess are they appropriate for the different, what hospice calls the levels of care. So we go in and we say, yep, they're appropriate for a certain level of care, and then we keep them, we put them on hospice in the hospital. But it's tricky. I mean, there's different levels of care. There's routine, which is your normal, the nurse comes out, you know, 2 to 3 days a week, and other services that I know we'll touch on.
Because I know it can be complicated, and obviously the key is if there is a concern, if there is an issue, give a call so that you can go from there. So what kinds of services might be provided? I realize everybody's different. So some people need certain things and others need other things. So give me an idea of some services that you would provide, and by who maybe.
I can touch more on the clinical. You have the registered nurse, which would be like myself or someone else. They're called the case manager. That pretty much is the middleman between everybody, and that's your main person that's going to come and make sure they're comfortable, the meds are there that we need for them. We assess their vital signs, their overall physical assessment, and then we also look at, are they comfortable, are they not comfortable, you know, what else do we need, because it's the registered nurse that's going to come out and do the initial admission, and then we're going to say these are the other services that we need in addition to. You then have the home health aide, who is a certified nurse aide that comes out and does all the bathing, the dressing, or certain people don't want a morning visit, so they want the aide to come in the afternoon and then sit and, you know, read the newspaper to them, play bingo cards, just spend time with them. If they're in a nursing home, they can do any afternoon care that they may need. So whatever it is for that patient, the nurse then looks at, and we tell them, I always tell my patients, you are actually the one that controls your care. You tell me what you want, and then I will make sure that your needs are met. And then that's pretty much where Joyce comes in with social work and other non-clinical aspects.
All right.
The other members of the team are your social worker, your chaplain. We also have volunteers. We have a volunteer coordinator. So volunteers that want to come in and provide their services or their talents could be anywhere from sitting with someone who just wants the companionship to someone who
they don't want to necessarily be alone while maybe they live with a family member and they're at work or
in facilities, they can take them to activities, or as well, if they have a talent, they can provide it to the hospice, whether it's playing music or they may be someone who has just a special gift that they want to share, and then they can just use their talent as an additional support to the whole hospice as a whole.
And I've heard a lot about some unique perhaps services, and it might be what you were just saying as far as the volunteer special talents. I've heard all kinds of things about aromatherapies and you were saying music. So you're talking everything from the clinical to the really interesting creative special care, right?
So that we can be able to tailor it to each person. We have a massage therapist, we have pet therapy. We do have a program called Tapestries, which focuses on our aromatherapy. That helps to stimulate memories for people, especially with dementia, to be able to have them interact a little bit more with their staff and with their family members, which is a very special thing.
I think that we have so much that we could really discuss specifically about hospice and hospice care and services, but I'd like to move forward with the program that I wanted to get to tonight, which is gearing into, because of those end stages and some of those issues, you guys have worked with people who are alone maybe, or with family members, and I think, how can we, there are, I'm sure, all kinds of issues that come up around the holidays. We all have those perhaps with family dynamics, whether it's just normal holidays, and then let's add this kind of stress and situation. So I think if we can talk a little bit about what you've seen with some of the issues and maybe the diffusion of those, and then real specifics. What are some thoughts, suggestions for the family and friends with that individual who might be going through that at the time, or even maybe people that, you know, it's a year ago and I don't know how to say something to my friend or what I can do. So let's kind of, who wants to, you tell me which one would be interested in taking kind of some of the issues and things that might crop up at this time.
Well, the most important thing to remember is there's no correct words. There's nothing that says you have to say particular phrases or special words to someone who's dying. The most important thing is just to be a companion, just someone to listen. And people find that just so rewarding because they don't like to be talked at. They have enough on their mind. There's enough that they're going through. So to be able to just have someone as a companion, to just listen and not say, oh, I know what you're going through.
Yeah.
You really don't know
Yeah.
unless you're the one who's actually in their shoes dying. So that's just the most important thing to remember is you don't have to know what to say. Just be there and just listen. And that's absolutely the most important thing.
Good,
Yeah.
probably overall good tip.
Right.
Okay, and how about, I guess if we talk about maybe in stages, so that's part of the process at the time. And I don't know if it's during that time or maybe right after the death. Are we seeing, how do we help folks, family members, let's say, that are working through that? Are there some thoughts, some tips at that time?
Well, part of what the hospice team likes to do, especially if we get in there early, which is what we hope for, is that we're making a plan with the family. So we're assessing whether they're going to have a difficult time coping, or if you just know that they're going to need a lot of extra support. And a lot of what we do is educate along the way, so they know what to expect with the decline physically, but as well emotionally and spiritually. So hopefully we've gotten to the point where they're going to be able to understand what's going to be happening, accept that in that moment, and just be able to just process it all. And
kind of a better management for
Right.
themselves as well,
Right.
and not maybe fall into that stress situation or crisis because of
Exactly.
the unexpected.
We always want to
You've kind of
revert
eased
that.
into that. Okay.
And we also do have bereavement support. So while the person is with us, we're all working as a team with them and telling each other what we think, what we feel with, so-and-so may have more of a difficult time, or it looks like they don't have much support. Their place of employment isn't being very supportive right now with allowing them to be with the person. So we're all talking together and trying to make it the best experience that we can, because we don't want them to have to look back on this experience as something that's going to basically plague them the rest of their life with, an anniversary that comes up. This is what was happening, and we want it to be a good experience. And after the death, then we also do have a bereavement coordinator. So we usually pass on to them what we believe their risk level might be. I usually make the first phone calls after the death just to assess how they're doing and kind of follow through with making sure we think that we know what kind of path they're going to be going on this time forward. So then we do follow them afterwards with following up with referrals, or do they want to continue with phone calls, mailings, visits.
So there is some extension to that period of time, because I think also if you've been that supportive and you've been the educator and the guide throughout that time, and then people disappear, that could be adding to that devastation, as well as I think. And you mentioned about a coordinator for bereavement. Is there support groups and things like that might be a resource to people?
They would be making those referrals, and when the coordinator is talking with those people for the first time, they have a checklist as to, would you like us just to continue to call you one-on-one? We have volunteers as well that do bereavement. So it may be a volunteer, it may be someone from the team if they were really close with them, and the coordinator says, would you mind continuing to follow them? As well, she may be able to refer to a group in the area.
Okay. I would also think that sometimes those folks, depending on other things that are happening with them, may need other resources themselves, not just through the grief and loss process, but even maybe just personally, they may have ignored their own personal health. And so really they need to make sure that they are now managing that better, and maybe it's just some kind of reassurance that you need to keep going to and keep those regular appointments and go out with friends and things like that. So let's, in the time left, if we can switch gears, and so that time has gone past and we think that the folks are doing okay, and you know, we're with them talking throughout the year, but now we're we're back at the December time, and we're rushing and we're busy, and we're sending happy holidays and Merry Christmas greetings. Again, you said before there may not be, there aren't, there's no wrong word, I guess. So what do we do at that period of time, particularly when you're sensitive to that other person's situation, maybe at the holiday time? Any thoughts about what we can do, say?
Well, I know some people are continue to feel awkward with even talking about the loss, but it's just important not to forget about it, is to acknowledge it. And whether it's just, how are you doing? Would you like to get together? It's just letting that person know that you're there and you're trying to understand.
Yep. Yeah, I mean, I lost my father 2 years ago, December 9th. So I can relate on many levels, which I always tell my families that I can kind of empathize with them. But we try to just talk about the good times and what Dad would have done. And I just encourage people just to talk about as much as you want, what's comfortable for you, because it's the memories of them that you hold, good and bad, but that, through that process and after they pass, and sometimes, I've had family members I've talked to years later, they still cry when they pass. And then they kind of laugh and go, I don't know why I'm crying. And I'm like, it's okay. It's just, I don't think grieving has a time limit.
Okay.
We always tend to, I think, miss the person.
And kind of say, okay, now the time is gone, get over it.
Yeah.
Yep.
Okay.
Yep.
You never get over it, you just learn how to live with it. And that's the important thing.
Yep.
Good. Well, believe it or not, we've gotten to the end of our program. I would like to just kind of quickly wrap up with, we've gotten some real simple tips. We have an understanding a little bit about hospice and hospice services through Life Choice Hospice, how to at least begin to at least make that referral and question going into having hospice services, and really starting to think about some things with grief and loss during the holidays. I guess I'd like to ask, with 1 minute left, anybody have one final tip or good advice for us as we look at this topic?
Just acknowledgement. Just
Okay.
acknowledge.
Yep.
Don't ignore the fact that someone's going through a very difficult time, and you know that they're spending time at the bedside rather than decorating for Christmas. It's just acknowledge it.
Okay.
Yeah, I would agree.
You would agree.
Absolutely.
Okay. Well, I guess I would also ask you really quickly, since you are from Life Choice Hospice, if people are still having lots of questions, don't know where to turn, think, oh, gee, I can call them now. Can you give us the best way to reach folks at Life Choice Hospice for us?
You can call our number at 800-557-7570. And we could even do question and answer over the phone, even if you just aren't sure.
Sure. Good. All righty. Well, I thank you both for being with us this evening, and I thank you for tuning in to Aging Matters program, and we'll see you next month.